Hello, everyone. My name is Rose. I am currently in a DNP program at Regis College, and my um, project is based on spiritual care and why nurses should have it as part of their daily assessments. So, just some background information on spiritual care. Nurses barely provide spiritual care to our clients, and a huge reason for this is because it's not necessarily part of the nursing curriculum. And as we know, nurses are always busy doing a lot of things, not just for the patient, but for other providers, for each other. There's just not enough time, there's not enough education about it. And there's also this idea that spiritual care is for the chaplains. And so many nurses try not to go into providing spiritual care. And unfortunately, it's also mainly done for individuals who are in palliative care or hospice, end of life. Basically, they are near death before spiritual care gets involved at all or is even talked about. Um, Again, some, evidence based reasons for why most patients do not get spiritual care or why they don't get enough of it is just on a general level, there's just not a clear definition of what spiritual care is versus religion or faith or belief. And again, like I said, there's a lack of time. Some people are very uncomfortable with providing spiritual care. And there's also the question of what if the patient has a different beliefs than I do? What do I do then? How do I still handle that without intruding on their beliefs or without them intruding on my own beliefs? So, just some quick definitions. So, faith is the hope that one has in something. So, you can have faith in yourself and a higher power. It's just your hope in something, whatever, or someone. Whereas spirituality is a bit more abstract. It's a connection between that person, that patient, and a higher power. Um, so it can also be viewed as a journey towards something greater. So if someone believes that their goal is to get to heaven, that is their spirituality. That is their higher calling. The goal is to get to heaven, and that's it. So that's their focus at that time. Whereas religion is very much about their traditions, their beliefs, their rituals. So for me as a Christian, I go to church 3 times a week or attend some type of service 3 times a week. I pray a lot. When I wake up, I pray. Those are my own rituals, practices that I grew up on based on my beliefs, my spirituality. So religion is very much more of the rituals that comes with someone's beliefs, someone's spirituality. Whereas the spirituality itself, again, it's more abstract. It's that connection that's there. And just as a caveat, you can be um, you can be spiritual and not have a specific religion. And we'll talk more about that later because there are some people who they they don't have a religion, they don't practice a religion, but they will tell you that I am spiritual, and they might explain that. So benefits of providing spiritual care is that there's an overall satisfaction when spiritual needs are met. Many patients feel like when nurses or chaplains or whoever the provider is talks about their spiritual needs and includes it in their care, it makes a huge difference because, again, we're not just looking at the physical aspect or the mental aspect of the patient, we're looking at everything, and we are involving we're bringing in what also helps them to heal and what helps them to stay grounded. It also helps them to be more comfortable and sticking with the treatment plans, which is something we want a lot, especially in psych. We want our patients to stick with their treatment plans. We want them to stick with their medications, their therapy sessions. We want them to be very active in those um, plans. So, for a lot of them, when their spiritual needs are met, they're able to do that even more. They're more willing to do it. They're also more willing to seek guidance, either from their pastor, and oftentimes their pastor will lead them back and say, hey, ask your provider, they probably have more information. If you need me, I can go with you, things like that. They're also more willing to ask questions. They're more willing to participate in their care. They it reduces their anxiety in general and their stress, because again they can use their spirituality, their beliefs, to help them deal as well with their problems, with their diagnosis, or whatever they might be going through. They're able to have this additional support to deal with it. It helps them to maintain their physiological needs, their psychological needs. It helps them to think logically. They have more support. It actually reduces their risk of harmful behaviors and increases their quality of life in general. And that is the ultimate goal for all of our patients, for them to have better quality of life. Um, Again, it impacts their coping mechanism, increases their lifespan. And so, one tool that is very, very helpful in explaining spiritual care and how to actually bring it into our patients is the FICA assessment. The FICA assessment looks at a number of things. It looks at their faith, which is again their beliefs, their meaning. What does your faith mean to you? What does your belief system look like? Is it important to you? Does it influence your life? Does it influence your medical choices? So I know for Jehovah's Witness, they don't believe in donating blood or getting blood transfusions. They don't believe in getting blood transfusions, and so if you are aware of that, you would know not necessarily not to offer, but to have that conversation with them and see how you can talk to them more about it, give them the education that they need about blood transfusions, and go from there. It's the same thing with some Christians. They like to pray before any procedures, and so having them take that time, asking them, do you need a few minutes to pray? But again, we wouldn't know that information if we don't have the conversation with them about their spiritual care. And also, how does their spirituality play a role in their community? Do they have a community of like-minded spiritual um, provider, or just people around them that helps them spiritually as well? And just how do you include their spirituality into their care, either it's psych or physical needs, whatever it is? How do you put that into action so it is a well-rounded care? So for us, to just ask them what faith they believe in, what their religion might be, just so they know that it's something that we care about as well. So I'm going to show you a video. Again, this is from the with the FICA assessment, just so you see how it is done. All right, so this is a lady who just went for her first went for a visit with a provider, and the provider is talking to her, and I just want to show how the provider initiated the conversation about spiritual care.
Now, and that's working. That's well, not as regularly as I should, but I'm trying to get into a pattern of exercising regularly.
And then diet, do you watch your nutrition carefully?
Yes, and I'm trying to do that too, be more proactive about that in a weight loss program now, and that's working. That's proving to be beneficial.
Great. And do you have any spiritual beliefs?
Yes, I believe in the one and true living God.
Okay. And are these important to you on a day-to-day basis?
First in my life.
Okay.
He is first in my life.
Okay. And do your beliefs influence you at all in your healthcare decision making?
Sure, because God is my first point of contact regarding anything, and as well as medical.
Mm-hmm.
And sometimes I consult my pastor, should I have to.
Oh, okay. All right. Well, that's important. What about a spiritual community? Do you belong to a spiritual community?
Yes, I belong to a Christian church, Protestant.
Mm-hmm. And do you attend that regularly?
Yes, I do.
Okay. And are they a supportive community for you?
Yes, they have a lot of programs or ministries for almost anything in life.
Okay. So is there anything else as your doctor that I would need to know about your spiritual beliefs?
Yes, that I do believe in medicines, but I consult God first, and I also pass some things by my pastor, but God is first in my life.
Okay, all right. So it's a real partnership here.
Yes, it is.
Okay. Well, thank you very much for sharing that, and I'll be sure to jot that in your chart.
Okay, so that was just an example of how spirituality or spiritual care can come up with someone who does believe to be a Christian. I'm going to show you another video of, again, same patient, but came back. And here we go.
I know in the past, your family's helped you, belief systems. Have you shared anything with your family about this?
My husband, and not too much with him, because I've just been so concerned and kind of worried about it. I probably haven't talked to him as much as I should.
And what about your faith? I know that's really always been important to you. Where are you with that now?
Probably haven't prayed as much as I should, or just, done what I should about that, just because this was caught me so off guard. But I have started praying more, and I do realize that when I do pray, that's when I start sleeping better, because I haven't been sleeping that well at night.
Have you talked to people in your church or your pastor about this yet?
Yes, I'm going to talk to him about it, so that I can get some counseling and just some support.
Oh, that's a really good idea, I think, because I know in the past you've told me that has helped you.
Yes, and the church is always there for you.
Oh, that's good.
As well as God, He's always there.
Yeah.
Good. So again, just wanted to show you how to bring up that topic of spirituality. There are other belief systems, obviously, besides Christianity. So Hinduism, I will send a link for this as well, so you can see the different types of belief systems out there. There's also atheism and agnosticism. They are different. So when you get this link, definitely click on it so you can see how it's brought up for the individual. It's just a quick example of it. And then obviously Judaism, Buddhism, Islam, again, just as an example of how the other belief systems might be different. And then there is this scenario that I want you to listen to. It's
So, Karen, can you tell me a little about yourself, about your living situation?
Well, sure. I'm married and I have a daughter at home still. And I just am a writer for a nonprofit organization in town here.
Do you exercise?
Oh boy, do I. I'm a biker, and every day practically I'm riding about 5 miles, and on the weekends often 25 miles. So it's very important to bike, and it's been hard with this knee injury that I can't do it.
I see. Is there anything else that's important for you that gives you meaning? Do you have any spiritual beliefs?
I don't really consider myself spiritual. You mean something like religious? Or?
It could be religious for some people, yes. For some people, it's something broader. It's something that defines and gives them meaning in life.
Well, maybe I am spiritual then. What gives me meaning is the riding. When I'm riding my bike and out in nature, there's this sense of awe and wonder that is very amazing, and it really puts me in touch with something bigger.
Well, it's beautiful. It sounds like it's very important to you. Does it also affect the way you make decisions about your health?
Well, I guess it could affect that, especially now as I'm thinking about this surgery. I really want to be able to ride, and I've been considering whether it's a good idea to do this surgery because I wouldn't be able to. It concerns me.
I see. Do you belong to any spiritual community?
Not really, unless you think of my biking friends as a spiritual community, and maybe they are, because we're always getting together and going on bike trips.
So for Karen, her spirituality is not based on the Bible. It's not based on God. It's not based on Muhammad or any typical religion that we hear about. For her, her spirituality is her bike riding. And again, that's something that we need to be aware of, because If you listen to the whole scenario, it's actually what's motivating her to get the surgery that she needs so she can go back to bike riding. So just having little information like this goes a long way for our patients because we can use it to really help them and support them and make sure they are doing well. Like I said, there are a lot of reasons why many nurses do not provide spiritual care. There are ways to also overcome those. If it's for many of us, I don't have time. Even if you don't have a spirituality, you can still provide spiritual care. Perfect example, I have never been diagnosed with a mental illness. However, I still work in psych field and I do my best to help and support our clients without, having experienced it myself. Because I am open and willing to educating myself and just knowing more about their diagnosis. So it's the same way with our clients. Even if we're not spiritual by ourselves, we still have to take the time to educate ourselves about it, talk to them, see what their beliefs are, and just make sure we meet them where they're at and use their belief systems, their spirituality, their rituals to help them to get to a place where they feel good about themselves and where they are actually healing. Um, and it's fine if we think it's too personal. Again, the goal is to help the clients. Thinking that patients will be offended, they might be, but it's to help them. So it's okay to ask the question. And if they say no, or if they say they don't want to talk about it, then we can leave it alone and just document that they don't want to talk about it. Um, Again, once we start talking about spirituality, for those who may be Christian or who believe in praying, or Muslims, and they ask for prayers, you don't have to pray with them, or you don't have to pray for them necessarily. You can tell them you're there for them and you will support them and you'll be with them while they pray. Or that might be a good point to say, okay, let me go get you, if the person's a Christian, let me go get you a pastor or a minister or an imam if they're Muslims, or someone, or a priest if they're Catholic. So just finding who their spiritual leader might be to come in and support them is also a great way. And even if you have your own strong belief systems like I do, just making sure, again, the clients, our patients, are first and foremost and not our own beliefs, because the goal is to make sure that they are doing okay and they are getting the support that they need. So I will send this out to everyone. I'll send out the PowerPoints as well as the links to this website. Um, as time goes on, please try to include this in your daily assessments, especially for new admissions. Just asking them what their beliefs may be, what their spirituality may be, if they practice anything, and document that, even if it's just a word they don't practice or they identify as Catholics. So, again, thank you for being a part of my study. I hope this has been somewhat helpful. If you have any questions, please email me. Thank you.